Understanding mental health disorders. Mental health disorders are conditions that affect an individual's thoughts, emotions, and behaviors, often impairing their ability to function in daily life. It's crucial to understand these disorders to provide support and effective treatment for those affected. Unfortunately, stigma surrounding mental illness persists, hindering awareness and acceptance. Resistant depression. Resistant depression, also known as treatment-resistant depression, is a form of depression that doesn't respond adequately to standard treatments like antidepressant medications or psychotherapy. Symptoms include persistent feelings of sadness, hopelessness, and loss of interest in activities once enjoyed. Causes may include genetic predisposition, chemical imbalances in the brain, and traumatic life events. Treatment options for resistant depression include different classes of antidepressants. Psychotherapy. Ketamine infusion therapy has shown promise in treating resistant depression by rapidly reducing symptoms. Ketamine's mechanism of action differs from traditional treatments, offering a new avenue for relief. Brain stimulation therapies like electroconvulsive therapy or transcranial magnetic stimulation. Lifestyle changes including regular exercise, healthy diet, and adequate sleep. Anxiety disorders. Anxiety disorders are characterized by excessive worry, fear, or apprehension that is difficult to control and interferes with daily life. Common types include generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. Factors contributing to anxiety disorders may include genetics, brain chemistry, and traumatic experiences. Treatment options for anxiety disorders include therapy such as cognitive behavioral therapy, CBT, or exposure therapy. Traditional medications. Ketamine infusion therapy has shown promise in treating anxiety disorders by rapidly reducing symptoms. Ketamine's mechanism of action differs from traditional treatments, offering a new avenue for relief. Relaxation techniques such as deep breathing exercises or mindfulness meditation. Post-traumatic stress disorder, PTSD. PTSD is a mental health condition triggered by experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Causes of PTSD can vary, but often involve experiencing or witnessing life-threatening events, childhood trauma, or military combat. Treatment options for PTSD include therapy such as cognitive processing therapy or eye movement desensitization and reprocessing. Ketamine infusion therapy has emerged as a potential treatment option for PTSD, offering rapid relief from symptoms and improving overall functioning. Medications like selective serotonin reuptake inhibitors or prazosin for nightmares. Support groups and peer counseling. Obsessive-compulsive disorder, OCD. OCD is characterized by intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed in response to those thoughts. Common obsessions include fears of contamination, harming others, or doubts about safety, while compulsions may involve excessive cleaning, checking, or counting. Treatment options for OCD include cognitive behavioral therapy with exposure and response prevention. Medications such as selective serotonin reuptake inhibitors or tricyclic antidepressants. Ketamine infusion therapy has shown promise in alleviating symptoms of OCD, providing relief for those who haven't responded to traditional treatments. Deep brain stimulation for severe treatment-resistant cases. Real-life examples of individuals living with resistant depression, anxiety, PTSD, and OCD can provide insight into the challenges they face and the strategies they use to cope and recover. Sharing these stories helps reduce stigma and encourages others to seek help. In conclusion, understanding mental health disorders is essential for promoting awareness, acceptance, and support for individuals and their families affected by mental illness.